My name is Rick Greene from the 1970 UVA School of Medicine class, and it's my pleasure today to speak with Dr. John Owen, who is Emeritus Professor of Internal Medicine here at the university. And this is a project that we're doing for the Medical Alumni Association, so we have a collective wisdom of our Emeritus Professors. So John, it's a pleasure to have you with us today.
Thank you very much.
Let me just start off by asking you to tell me, how did you arrive at University of Virginia? What was some of your background that finally brought you onto the academic staff?
Well, let me start off by saying that I owe a great deal to Emperor Hirohito, because if he had not attacked Pearl Harbor in 1941, I would not be here today. I was born and raised in Halifax County, Virginia. My father was a country doctor. And I always knew that I wanted to go into medicine because I wanted to be like him. But what kind of medicine and where was just something to be resolved in the future. Well, Emperor Hirohito took a hand. Pearl Harbor happened. The U.S. went to war. There was a tremendous expansion of manpower. There was a perception that we would need more doctors to staff the manpower. So they set up in the Navy what we call the V-12 program, in which you signed up in college, you were exempt from the draft, you went through the rest of your pre-medical and medical careers completely supported by the Navy, and then you paid back your service. So when Emperor Hirohito made his move, I became determined that I was going into medicine as soon as I could. And my way was paved financially, and my objectives were clear. I finished college, immediately applied to the University of Virginia because my father had gone here. And I got back a note saying, from Dean Jordan, said, "You're accepted, please send $25 for your application fee." No interviews, no MCATs, no nothing. And so I came to the University of Virginia very happily and spent 4 happy years here.
Did you ever, were you on active duty in the Navy?
Yes.
And how did that military experience sort of color what you were going to do in the future? Have any effect on you?
I don't think it actually affected what I was going to do, except it occupied time in a way that I had planned for it to occupy time. I applied for a civilian internship and was happy to get one. But during my internship year, the Navy wrote me and said, "We'd like you to go on, if you'd like to go on active duty and still stay as an intern, but just get paid as an active duty officer, we'll be glad to do that, but in return we want you to spend 1 year wherever we want to send you." I said, "That's great, now I can afford a car." So I bought my car. They sent me to Washington, D.C., where I met my future wife, and because I had a brand new convertible, she paid attention to me. 2 years later, the Navy called me again. He said, "We want you to come back in service." I said, "Good, now I can get married." And I did. And so that's how the Navy influenced my career.
It's amazing how serendipity plays a role in
Oh,
what we do, isn't it?
Yes, it is.
Yeah. Well, tell me a little, how did you gravitate toward internal medicine and not surgery or anesthesia?
Right. Well, I don't think I knew that I was gravitating in medical school. I was considering for a while psychiatry, particularly when psychosomatic medicine became all the rage, and that got me very much interested. But I interned at Cincinnati General, and they require 3 months on internal medicine, and we had such an excellent faculty and such a challenging population of patients that I soon said, this is the range of the scope of a practice that I would be quite happy in. So I sort of settled on that in my internship.
Now, I know you're a Virginian. I mean, obviously, being in Virginia, going to the university is important, but what was it that kept you here at the medical center? What are the things that really were the magnets for you?
Well, that's a good question, and I think that every double who or triple who comes back here on the faculty has to answer that question. I suspect the answer would be the same for most of us. We just fell in love with the place, and we would have practically scrubbed the floors and changed the bedpans for an opportunity to come back and be on the staff.
Well, mentors play an important role. Tell me something about who were your mentors here, and what do you remember about them?
I remember some of the mentors that we were afraid of. We were very much afraid of Dr. Chanyatin, who was the chairman of biochemistry, because that was the crucial course, and many people failed that in the first year, and they were gone. As I got into the clinical years, I remember Dr. Orich in surgery was just an unforgettable, charismatic sort of doctor. And internal medicine, Dr. Mulholland was sort of the king of them all. But Dr. Level was very kind and very thoughtful and lovable, and all the people in internal medicine I really adhered to.
Well, let's assume you hadn't gone into medicine. What would you have done? What did you want to do in your life if it wasn't medicine?
That's a hard question to answer, because I've been so committed to it for so long, and I considered no other specialties except psychiatry. And I soon concluded that that didn't require the skills that I had, or required skills that I did not have. So I think that's the only answer I could give you.
Well, over the years, obviously medicine's changed a great deal. Some good things, some bad things. What are the things that you're concerned about today, that either in the academic world or in the world of medicine generally, that you're concerned about how we've changed?
Well, it's tempting to draw up a long laundry list, but I think to do that sort of stamps you as a very antiquated personality. I'm sure that in a lot of ways medicine has improved. I know on the clinical side you can list dozens and even hundreds of advances that have taken place in my lifetime. To think that I perceive, and perhaps I'm a little sensitized to this, is that many people of my generation, many physicians of my generation, sort of unanimous in saying medicine isn't fun anymore. And they cite these and other factors, regulations, the electronic medical records, the limitations on what they can do and how they can do it, and to some extent, financial constraints of reimbursement. So I think those are real concerns. I think they're hard to ignore simply because they're so hard to specify, be specific about. But I talked to a doctor last night at the free clinic, and he was really discouraged about his own private practice.
Well, tell me a little about what you're doing now. Emeritus, of course, has its own position in life, but obviously you're busy. And what are you doing today, either in medicine or outside of medicine?
I hate to disabuse you, but I'm not really as busy as I look.
Well, you talked about being at the free clinic.
Well, I was there because we were having a special occasion, and I was a member of the board of directors there for 20 years, so they sort of invited me back as an old-timer.
So you participated in many things. Tell me about some of your participation outside of medicine over the years, some of the things you really enjoyed doing, either with your wife or with others.
Well, let's see. let me start with the extracurricular things first. My wife is also from Virginia, and we have enjoyed exploring numerous relatives and connections and special places in Virginia. And in her family for a long time, there's been a home place in the Northern Neck, which we've had great times visiting and vacation. And my children enjoy it also. I always loved to travel. My wife was not so keen as I was, but after her death, I made several trips to Europe, which I enjoyed a great deal. On a usual daily basis, I've enjoyed playing tennis to the limit that I can play, and working in my garden to the extent that I had the energy to work in it.
Finally, let me ask you, I'm a student at the university. I'm getting ready to finish, and I'm coming to you for advice, either from what I want to do in life, or things that you've learned over decades of doing this. What advice would you have for the young UVA graduate today?
Well, I'd start off by saying I cannot predict the future, and I don't know what the future holds for medicine in general, or the kind of medicine that you're going to practice. But the one thing that I do know, and I think this is as important as anything you can impart to a young person, is don't ever forget the pleasure of working with patients. Because I have found that to be the one thing that tends to get overlooked, because it's assumed that you're going to enjoy working with patients. But if you have a million other things that you know you have to do, somehow that gets down to the bottom of the list. I can remember one instance when I was making rounds with a bunch of third-year medical students, their first exposure to the wards. And I wanted to give them a lesson in how you interact with patients. And so I said, let's go down the hall, we'll knock on the first door, we'll go in, I'll introduce myself to the patient, and we will study the techniques of developing rapport. And they nodded and they followed me in and lined up. So I introduced myself to the patient, who was a young middle-aged man, just admitted he hadn't even gotten into his bed clothes yet. And he was lying on the bed, and so I asked him where he was from, and he said, I'm from Nelson County. Well, Nelson County in Virginia is one of my favorite counties, so I was prepared to really start off with a good, fresh head of steam. So I said, well, where in Nelson County? And I tried to pinpoint his location. And he looked at me finally and said, are you from Nelson County? I said, no. But I love Nelson County. I'd love to drive over those curvy mountain roads and stop by an orchard and steal an apple off an apple tree. And I thought this was going to go big. And he looked at me with such disappointment on his face. He said, I don't know anybody in Nelson County would give you all the apples you wanted if you just asked for them. And I stood there, my mouth opened and shut, and opened and shut. And I said, well, thank you very much. So we filed out, and I turned to my student group and I said, well, I think you've learned something today, but you didn't learn it from the professor. And I think the whole point that I wanted to make was, when you deal with patients, you learn things from them that you didn't know about yourself. And you would never learn from a professor, because the professor has his viewpoint, the patient has his viewpoint.
What a wonderful story, and it shows why you're the consummate clinician. We've been enjoying today talking with Dr. John Owen, Emeritus Professor of Internal Medicine at the University of Virginia. John, thank you so much for being with us today.
It was a pleasure.
Appreciate it.